just going to give a little preface as to what we're doing here. This is a simulation certification class that we use to educate oncology nurses to come in and be like, we don't have to. We don't have to at all. That's fine. So, and then what I'm going to do is I'm going to read you the scenario after that. There'll be 2 of them that we'll do. What we'll do is a scenario, then debrief. Scenario, debrief.
Are you in on the scenarios or
Just the group effort. Just you
and
guys, and then I will go
lurking
in
in the background as an observer.
Right. And then I will go in here. I will actually run the simulator.
And you'll tell us what.
Yippee yay.
Exactly.
Exactly. All right. This is Daniel. Has everybody been to the sim lab before?
Yes.
Okay. So my name's Sam Combs, and I am a student at Bryan LGH, and I need to record this for exercise that we have, an assignment and debriefment. So what I'll be doing is recording your performance and simulation, and then audio taping our debriefment. Is everybody okay with that?
Yes.
Okay. Great. So everybody's familiar with the simulation lab. I know I've had you guys down here in Code Blue before, so we just go through a quick rundown of where everything is. IV pole and stethoscope right there at his corner. Fluids, oxygen tubing right back here. Here's your monitor. I won't do anything unless you say it. I'll be in the booth controlling Daniel, of course. So if you say, I need a blood pressure, Sam, of course I'll do that. Remember, I can only hear one of you at a time, so if one of you wants to be the lead nurse in this, that's great. So, is everybody ready for your scenario? Okay. So this is Daniel. He's a 35-year-old male newly diagnosed with a stage 2 Burkitt's lymphoma. He's currently on day 3 of cycle 1 of treatment. That's Cytoxin times 5 days, prednisone for 7, and allopurinol for 14. The nurse caring for Daniel has noticed that his urine output has decreased over the last 6 hours. Okay? Any questions? All right. I'm going to return back here and get Daniel going, so if you guys want to get started, you can.
Let's do the primary nurse. You're talking about it. Oh, okay. So, Daniel, how are you feeling today? Any complaints of pain or anything? Any pain, Sam? Okay. I'm ready.
I don't feel well.
Okay. How long have you been coughing like that?
I don't feel well.
Okay. Let me take a listen. Can you hear lung sounds with this?
Yes, you can.
Maybe it's just me, but I don't hear too terribly much air moving. If anyone else wants to listen, I don't know if I'm supposed to or not.
It's difficult to hear all this.
What have our eyes and nose been, Sam?
Sounds like SIDH.
He said 1,200 in, 250 out.
Okay. So, maybe the first thing.
diminished spread sound.
Diminished, okay. So maybe the first thing we should do is bladder scan him to see if he's retaining it. So, say we're going to bladder scan him. How much urine did we see?
$150.
Okay, so it seems like
That's for how many hours? 150 for
6 hours.
6 hours.
Okay, so does he have any IV fluids going?
No.
No? Okay, so we'll call the doctor and get some fluids started. So, say we're calling the doctor to start IV fluids, so what is our order?
You can have D5 or normal saline at whatever rate you need to produce 150 cc's of urine an hour.
Okay. So, should I open this?
Purple. And she said yes.
Okay.
I don't feel well.
We wanna get a set of vitals?
Yeah,
Yeah,
let's
let's
do
do
it.
vitals.
Let's check his pressure.
Is your breathing okay? Is your breathing okay?
Do I spike it?
No.
Does she spike it, Sam?
No.
Yeah, go ahead and spike it.
Okay, so he says he's
So we're
not.
not gonna.
We're gonna give oxygen.
Yeah, I won't. What are his stats?
What's our
Her
last
breathing
vital
is
signs?
Her breathing is not so good, so we're gonna get some supplemental oxygen.
His ears aren't there.
Yeah.
We're just gonna check.
2 liters.
I don't have it going, I promise. Okay. So we'll start IV fluids at 100, you think?
Yeah.
Pressure's okay. Stats are okay. Respiratory rate is 12.
Is that helping you, the oxygen?
No.
Maybe we should try a neb treatment.
Oh. You feeling okay?
No.
Okay, so
Let's go ahead and give the doctors a ring.
yep. So we're calling the doctors. I want a stat 12 lead, please.
Rapid response has been notified.
Call the
Rapid
rapid.
response.
Rapid's on the way, please. Call 9 North.
I'm so sick.
We need a bed.
This monitor's gonna fix it. Sam, what does our 12 lead say? Irregular. So it could be AFib.
You have any chest pain right now? Are you hurting
Yes.
somewhere?
Your chest is hurting.
Yes.
Pressure's dropping, so I'm gonna increase his IV fluids. We're gonna go ahead and give him some nitro.
Okay, rates of 200 normal saline.
Yep, 200 normal saline. Give him some nitro. Draw some stat CPKs and troponins.
All the labs.
Yeah, we'll see what our labs say. Is that from the nitro, or was that from? He's just coming down.
That could be from the nitro and the fluid increase.
Seemed like it happened really fast though.
His pressure's still low though.
No, it's the nitro too. So we're gonna keep his fluid up.
Are you still with
maybe.
us?
Daniel.
No.
Nope. Oh.
Nope.
I'm feeling very dizzy.
Okay. So
Give
his
some
pressure's-
bolus.
Yeah, so
We've
we've
bolus,
got our
increased
yeah.
fluids,
at 500.
Mhm.
we've got our fluids wide open. Let's just keep them wide open. Are you with me?
I'm feeling very dizzy.
Let's go ahead and get the code card close by. Let's check for a pulse. Daniel. Do you feel a pulse? Daniel.
Yes.
Okay. Stay with me. We're going to increase his O2, maybe put him on a face shield. Or we can say high flow for now.
Yeah.
We'll do high flow at 12. Oh, there's rapid. Hi, rapid. So let's give some, is it epi or atropine for Brady?
Still atropine,
So
yeah.
let's give 0.5 of atropine.
0.5, yeah.
Okay. Or purple, that would be purple.
Rapid is asking what treatment he's receiving.
So we've given him fluid boluses, increased his O2, we just gave him 0.5 of atropine.
We got any recent labs on him?
We drew
drawn
some CPKs and troponins, we gave him nitro for chest pain. Okay, so 0.5 of atropine is in.
Rapid is asking what his diagnosis is. what were precipitating factors to the event?
So
Burkitt's lymphoma,
Oh,
day 3 of 5 on
Yeah, cycle
cytarabine.
2. I mean, stage 2. Buckets.
So what would be causing this? Really? Could he have a chest mass from his lymphoma? Can we do a chest X-ray, Sam?
Yes.
I'm gonna get. Well, how long do I have to wait before I can give another 0.5?
5 minutes, 0.9.
Daniel, you awake? You with me?
Yes.
Okay, stay with me. How are you? Is your chest still hurting?
Yes. No.
Are you confused, Daniel?
No.
Okay.
What time was the last nitro given? About 5 minutes ago.
Yeah, atropine was about 5 minutes ago, so I'm gonna give another 0.5 of atropine. Have we talked to 4 Reynolds?
We transfer now?
Where's the doctor?
Okay.
Heart rate's
Heart
coming
rate's
up.
coming up.
Still wanna increase
Blood
his
pressure
O2 a
89
little
over
bit.
46.
Can we get another pressure on him, please?
Yes.
Thank you.
Ready for your next atropine in case needed.
We can get it ready. How, are you still feeling so dizzy and so sick?
This is Nancy. Can I help you? Hi. We have some issues with his blood pressure pulse. His O2 is coming up, but his respiration is staying, well, they're staying steady. He was complaining of some chest pain and dizziness. Right now, he's not complaining of chest pain. Yes. Yes.
So what is it
CMP.
about Burkitt that would cause this?
Okie dokie. Thank you.
The only thing else would be like a chest mass.
Let's pull some labs for tumor lysis.
Okay.
Go top.
Go talk, check CMP.
Yeah, they're off to the.
How are you feeling?
Do we have any results on the labs yet?
The previous one.
Yeah.
The previous, we have any?
Yes. Your enzymes were negative.
What were his morning CBC results? I mean CMP results.
He had BUN is 30, crit 2.5, potassium 6.7, phosphorus 5.9, calcium 6, uric acid 10.
Okay, so we're gonna give some calcium gluconate, probably D50 with insulin. Recheck labs. What was his? Did you say his LDH?
It's elevated.
Okay. And your uric acid was up too. Okay, so probably some more allopurinol
Yeah, increased dose of that.
and keep him hydrated.
Mm-hmm.
Okay, so we're giving calcium gluconate, D50 with insulin, and then we'll repeat labs.
Okay, excellent.
And KX-Lite.
Okay.
Okay. How are you feeling?
I'm fine.
Alright.
Good.
Yay, we fixed
You
you.
put the code card back.
Okay, guys, if you'll come to the debriefing room, we'll talk about it.
Saved him, so lost with that.
Uh-huh.
He's
Every
just, I
time,
just can't
yeah.
keep my mind when I'm doing it that way. I don't know what it is. It's just like,
Are we being audio recorded now?
Yes.
oh, yeah.
Ooh, so no silly jokes.
No silly jokes. You know. I'm sure everybody has silly jokes in debriefing. So we won't get too all right, how do you think we did? What went well?
Teamwork.
Teamwork was very good. What else?
Get
Well,
the
we
lab
started-
guy right away.
Getting started on
You
fluids.
jumped right in on the assessment.
Mm-hmm.
You guys knew automatically start listening for lung sounds and things like that. So that all went very well. And Carrie, you kind of took the lead from the beginning, so that was good. You had that leader designated from the start. So let me ask this. When we first started this scenario, you guys were kind of hesitant to come forth to the simulator. Why? What caused that? Was it just the environment? Were you just a little not sure about where to start? Was it that you didn't get oriented good enough? What was?
I don't know, just like what Joy is saying, we've been doing this almost every year, you know,
Uh-huh.
for code, blah, blah, blah.
Code
It seems
blue.
like every time
We're
Exactly.
always staying
Somebody-
back
yeah,
until somebody
yeah,
pushes
just
it.
Exactly.
Get to
you
it.
have something in your mind, but it's just, you can't.
Right, and I
you know.
saw that in there is we had trouble switching from code blue mentality to tumor lysis.
Right.
But that's okay, once we made that switch, you guys were all over it, so I mean, that's, you know, that's good, that shows that we need to kind of cover other stuff in simulation other than code blue all the time, right? Yeah, it would help you. Okay, so, you guys got the O2 on him right away, you gave him the atropine for the bradycardia, that's very, very good. As soon as the doctor called and said do a tumor lysis workup, what hit your mind?
CMP.
Yeah, you guys went through the whole lab workup. I heard some medications being hollered. I heard some fabulous interventions going on. What about this patient made you think, oh, tumor lysis,
Burkitt's lymphoma.
Burkitt's lymphoma, and his treatment course, right?
The bad
Yeah.
ones.
Yeah. So
He was already on allopurinol, just wasn't a big enough dose for him.
wasn't a big enough dose for him.
Okay, it was already high previously this morning.
K was high this morning, exactly. So he was at it, and his urine output was starting to fall off because what does the kidney do? The kidney rids itself of phosphorus, right? So the phosphorus was going up, the kidneys were shutting down, so he's retaining all that, and the calcium was on its way down. So we saw evidence of all that in his labs, that reciprocal change between phosphorus and calcium was there. The potassium was high. We saw LDH was high, BUN and creatinine showed the kidney issues. All that's hallmark tumor lysis problems. So with that. So what is tumor lysis?
So bring him into the cells.
When you have a large tumor burden, especially in like lymphomas and the MLs like AML, CML,
Yeah.
that heavy burden when it is released into the body doesn't know what to do with all that extra stuff that the cells hold in.
That's right. That's right. That's exactly right. Making sure we hit all of our objectives here. What would we consider doing for, because I heard you guys treated, so the uric acid you treated with ibupropanol. What else could we consider?
What's the drug that you give for calcium?
Is that the other right there?
What'd you say?
What's one?
Rest.
That's
Uric
good.
acid.
Yes,
Yes, there you
They're
go.
giving that some for adults.
I
They're
see.
starting, we're seeing it in the EMT unit for
I hear
for
it more
adults.
and more in the BMT meetings,
Yeah.
so they are starting to give that some for adults. What about for the fluid issues to help diuresis?
Maybe some Lasix.
Get some Lasix. The, loop diuretics or mannitol. So we treated the hyperkalemia with calcium gluconate, insulin, and D5. What about, and KX-late, you guys said. What about
50.
hyperphosphatemia?
D50.
What did I say?
You said D5.
Oh, I'm sorry.
I
D50,
knew
that's
you meant,
right.
I knew you
Yeah.
meant D50.
What about the treatment of the hyperphosphatemia?
Once the calcium comes up, it'll have an inverse reaction with the phosphate, so it'll drop automatically.
It will.
Read time
Right.
depending on how fast it's going to drop.
And phosphate binding antacids.
Yes.
You can get those as well.
Red Bella.
Okay.
Is that Red Bella?
Huh?
Red Bella. Is that what it is?
No, I think it's more like the Rolaids Tums type thing, right?
I think it's Tom's.
It's Tums.
Yeah.
Because if you're trying to bind calcium, it's rolaids, and if you're trying to bind phosphorus, it's tones, I think, is how it works.
Okay.
So where would Daniel most likely be placed? Would he stay on the floor?
No, with his K, instead of being high, he's gonna have to
Not
be
with
with
that K, right. And if we corrected him earlier on, before his K got to that point, he may stay with us on the floor.
Yeah, he can stay on the floor.
So that might be an appropriate placement for him. Do you guys have any questions for me? Okay.
What's one big important principle in tumor lysis syndrome?
Prevention.
Good job.
Always.
Prevention.
That's all.
And they'll usually get BMPs about every 6 to 8 hours if somebody's really at
Right.
acute risk.
I usually see him more every 8.
6 to 8. Yeah.
And they'll cut their fluids off, make sure they get their fluids.
Yes.
Yeah, they'll be aggressively hydrated.
Right. Okay, so you guys know that if you have questions later on that you want to talk about that you weren't clear on, because sometimes I know that you like to go back and reflect on things and you think about, I wish I would have asked. Sally or I are available.
Yes, ask us.
Ask us, email us, call us, page us, text us.
Don't text me, you won't get it anytime.
Sally did that. But we'll be happy to catch up with you about that, okay? All right.
All right, we're doing one more, correct?
We are.
Yep.
That's it. We'll stop that for a moment. Okay, this is our second simulation. Are you guys still okay with me recording and audio taping you for the second? So this is Ramona. I know she doesn't look like a Ramona right now, but this is Ramona for a few minutes. And she's a 40-year-old female who had a portacath placed for chemotherapy to treat breast cancer. She's currently progressing well on treatment, but began to feel bad about 36 hours ago and decided to make an appointment with her oncologist. In clinic, she described just feeling weak and tired. I'll be in the back.
How long ago was the port placed?
48 hours ago.
Okay.
So is she in the room now? She's admitted?
Yes, she's in the
whatever
oncology clinic right now.
Oh, she's in the clinic,
Yeah.
okay.
Who's primary?
You did such an excellent job.
You go for it. You think it look good.
Be the supplement.
Hi Ramona, how are you feeling today?
I'm fine.
Are you having any feelings of distress in any way?
No.
Well, let's go ahead and we're going to check your vital signs and see how you're doing. See what your temperature is and everything, and I'm going to listen to you, okay?
Okay.
These are really good to hear with.
Your hands are really cold.
You're really warm.
What's our temperature?
102.
All right, let's go ahead and draw some cultures.
Culture times 2.
Yeah, let's go ahead and
X-ray,
Yeah.
urinalysis.
we're gonna need a culture from both
Urine
arms and
culture.
some from the port.
X-ray.
Got her hooked up to some fluids. We've got her on
O2.
Yeah, we're gonna put our O2.
My oxygen.
Okay.
Let's go ahead and
Rapid's
call
on the way.
rapid.
I need my oxygen.
We've turned the oxygen up to 2 liters.
Let's put her. Is she a mouth breather? We can put her on a face shield. I think that might help. Might
Yeah.
make her feel like she's getting some more.
Yeah.
So we've got a face shield on her. Okay. So we've drawn cultures.
Cultures are drawn, we're gonna get an X-ray.
Let's do a chest
Get
X-ray. So how does the port look? Is it red?
It's red and inflamed.
Okay.
Alright.
Alright, let's stop using the port, let's put a peripheral IV in her, and so we,
Got a peripheral. It's not easy.
That was good.
When was the last time you peed? Ramona?
Questionable sepsis, call the MD, see if we're gonna run some soon, what kind of antibiotics we need to run.
Do you know where you are?
No.
Okay, what's
She's
our
confused.
white count?
Let's go ahead and draw CBC, CMP.
I'm so sick of my
Lactic
stomach.
acid.
I'm
Yeah, let's go ahead
Basin. I'm gonna puke.
Basin.
Let's get a lactic acid drawn.
Yeah. And
We're gonna treat it as cope sepsis according to the MD, so we're going ahead and get fluids running wide open.
and we're waiting for the antibiotic. Already.
Yes,
And we've already
Antibiotics.
notified pharmacy.
Yeah.
Okay.
They're sending it right up.
So I need Zosyn or 2 grams of
Starting.
Zacapine. Let me hang that.
All right, we've got the antibiotics in. They're infusing.
Fluids are open along with it.
Yeah.
Mm-hmm.
Ramona, do you feel like you have to pee?
Could you please help me up to the bathroom?
Okay.
Let's maybe use a
Maybe
bedpan.
bedpan.
Yeah.
Yeah.
Okay, so roll.
Roll her
Bedpan.
or
Bedpan.
bedpan.
Alright. She peed.
Roll.
Study urine culture.
Mm-hmm.
Is it concentrated? Is her
Yes.
urine concentrated?
Yes.
Yes.
We'll study UA, urine culture, all that good stuff.
Let's do a repeat blood pressure.
Oh, that smells so bad.
Okay, you might have a little infection. That's okay. We're gonna take care of it. Do you feel like you're breathing any better?
I don't know.
Okay, we'll just work on some slow, deep breaths.
You still feeling sick on your stomach?
I don't know.
Let's give some Zofran just in case. Pressure's doing a little bit better. So we got 4 IV Zofran.
Alright, still up. Going down there.
So we've opened our fluids, we've drawn cultures, we've given Zacapine, or Zosyn, I'm sorry, and Zofran. Set all of our cultures, O2 support,
We've had the chest x-ray done.
and chest x-ray.
Okay, guys, we can debrief.
Looks like she'll be going to the floor.